All right. Good evening, everyone. Thanks for tuning in. We're excited to bring you a special presentation tonight on female fertility. Is she pregnant? If not, why not? Our speaker tonight is the incredible Dr. Frances Smith, president of the OFA, board certified theriogenologist, and a dog breeder herself, and much more. We're aiming for the presentation to be about an hour, hour and a half, depending on how many questions we get. Next slide, please. All right. So my name is Sarah Manzi on the ProPlan Canada breeder team. I'm a second generation breeder of Portuguese water dogs and Lagotto Romagnolos. I've handled many breeds other than my own, and I've also had the honor of judging both of my breeds' national specialty sweepstakes. At ProPlan, we understand your passion and make every effort to support our breeder program members. So let's get into some general housekeeping for our webinar. We're a big group today, so we're going to keep everyone on mute during the presentation. But please do put your questions in the Q&A box as we go, because I'm going to jump in and out and ask questions on the topic that we're discussing. So if you have a specific question to what Dr. Smith is presenting on, pop it in the Q&A. Otherwise, we're also going to have a Q&A at the end after a short sponsor message from me. So we ask that you keep your questions to the topic that we're covering today. Take a moment to note the difference between the Q&A box and the chat box. We're only going to be taking questions for our presenter from the Q&A box, but feel free to use the chat box to connect with others during the presentation. All right, without further ado, over to you, Dr. Smith.
All right, just one other comment I will make. I will be glad to answer questions that you have on this topic. Realize that the Veterinary Licensing Board does not allow me to do what is called telemedicine. So I cannot diagnose or treat any one individual's dog. These will be general recommendations and where you go next. So just so that you know, I can't say do this or tell you you must do that. All right, with that being said, we'll get started and I look forward to this. So this is me, Fran Smith, DVM, PhD. I'm a diplomate of the American College of Theriogenology. My PhD was done at the University of Minnesota, and the title of my PhD was Cryopreservation of Canine Semen Technique and Performance. During my PhD, I developed about 17 different buffer extenders for frozen and chilled semen and the surgical technique for insemination with frozen semen. I recently retired from small animal practice. I'm one of the few board certified theriogenologists in small animal. I breed, own, train, and exhibit Labradors. I'm AKC approved to judge hunting, retriever tests, and field trials. I also judge lots of AKC sweepstakes, not just for Labradors, but for other breeds. I'm the president of the OFA, the Canine Health Information Center, the president of the Labrador Retriever Club, recently reelected, and the health chairperson for the Labrador Retriever Club. So when we talk about females, and if you come to me with a female that has a breeding issue, she hasn't become pregnant, history is critical for us to figure out why she might not be pregnant. I want to know the age at first heat, the length of her cycle. Did she ever stand for breeding? Now realize the way we manage many of our females today, she may not have had the opportunity to stand for breeding, but in that case, was she flagging? Did she show signs that she might have been receptive to a male? Was a stud dog interested? Again, because we manage our dogs differently, some of you may not have any stud dogs. Critically, what was the date of the last Brucella canis test for both male and female? We are going to spend just a little time on Brucella canis, but V. canis is the most significant sexually transmitted disease of dogs. It is transmitted from male to female or female to male, and it is not transmitted only sexually. I cannot tell you how often people say, well, I don't need to test so-and-so because they've never been bred. That is not true. A dog can contract brucellosis from licking the urine of another dog, licking the genitals. The first case of brucellosis I ever saw at the University of Minnesota was actually a dog that got brucellosis in a dog fight. So brucellosis is real and not uncommon, certainly in the US. I don't have good prevalence data for you in Canada, and I know this is a Canadian talk, but it is not rare. It is also devastated in a kennel situation because it is a reportable disease, meaning it has to go to your health department. And the typical recommendation for B. canis dogs is euthanasia. There are some options with long-term antibiotic there and permanent isolation, but it is an incurable disease. It can literally wipe out a kennel. A breeder that I know in Minnesota, this was a number of years ago, had a stray dog jump his fence and bred one of his bitches in his own yard. She ended up Brucella positive. She managed to infect just by sharing housing the whole kennel, and he ended up having to euthanize 17 Labradors. Pretty sad sight. So be aware of B. canis. No one's out to give you an extra job or make you worry, but it's a very, very serious disease. We want to know, is the female proven? Meaning, has she ever whelped? And is the stud dog proven? And that means he has puppies on the ground that are less than 4 months of age. Again, clients will come to me all the time, well, I use this stud dog. And then I say, was he proven? Well, yeah, he sired puppies. When was the last litter? What you need to know about the stud dog is that when he ejaculates or breeds the female, that semen, those sperm cells were made in his testicles about 70 days ago. So here we're going to say, you tell me the stud dog had puppies 6 months ago. So 6 months plus the 2 months of pregnancy is 8 months, plus the 70 days to make the sperm. That gives me almost 11 months ago that we know the dog's testicles were normal and he was producing normal sperm. So a stud dog being proven doesn't mean once upon a time he had a litter of puppies. It means, is he currently proven? What food and formula of food are the dogs fed? Again, one of the things I deal with in the United States is people want to feed really good food when the bitches are pregnant, and the rest of the time are more concerned about their pocketbook. If you are breeding dogs, you need to feed a quality dog food. And I'm a big fan, and I personally do feed Purina Pro Plan 30/20. All of my dogs get it. They get chicken and rice, but there are other formulas. It's an all life stages food. The advantage to that is I can start my little puppies on it when we first start them on solid food. They can eat it all of their life. The geriatrics can eat it. But particularly for your bitches, they need an all life stages food all the time. You can't feed a bitch poorly, and then when you think she's going to come in heat, rapidly switch her to a better food and expect that you are going to have good results nutritionally. If you think about pregnancy in any mammal, but particularly in the canine, if the mom dies, there aren't any puppies. So if the mom has suboptimal nutrition, what is going to happen? Nature takes care of the mother so she will survive. So she's either going to have a small litter, she's going to have small puppies at birth, and very poor puppy survival. Okay, the other thing I need to know when we're talking about our female that's not pregnant, what medications are used to control internal and external parasites? What supplements, vitamins, nutraceuticals, and treats are used? Many supplements, even some vitamins, are toxic to fetuses and can cause pregnancy loss. Likewise, the products that are used for internal parasites and external parasites should all be products that are approved for use in pregnant and nursing dogs. What's your water supply? Well water or city water? If it's well water, particularly, when was your last water test? Nitrates in well water can be a significant influence into reproductive issues. Again, are the dogs housed individually or in a pack situation? If you have a big enough pack situation, much like a wolf pack, some of the more submissive females will not cycle regularly. Are dogs hand-mated, meaning do you hold the bitch and let the stud dog breed her, or are they bred at will? Are you doing AI, or how is the bitch being bred? What's the age of the male and female at time of breeding? Peak reproduction in the bitch is age 2 to 4. Breedings before then are suboptimal. Breedings after that are definitely suboptimal because a female puppy is at birth has all the eggs that she can possibly ever ovulate. With every cycle and as she ages, more and more eggs are lost. And even at the end of her life, she will still have some eggs left. After age 6, conception drops pretty drastically, litter size drops, and puppy survivability drops. Males are not quite as critical, but again, 2 to 5 is probably optimal. The difference with a male is you see many males who are very fertile for a number of years with very, very little change in their sperm production, and then all of a sudden they will have a stop. And it's just like turning off a faucet. That might be at 5, it might be at 8, it might be 10. There are some dogs who are very fertile into old age. AKC requires a semen evaluation by a veterinarian on any litter that is sired by a dog that is 12 or older at the time that the semen is collected. I don't know if Canada requires that or not. You guys would know, I certainly don't. It's also important to know what's the environment in the kennel? Is it air conditioned, heated, natural? Heat is a big enemy to reproduction. Probably males affected a little more than females, but a female pregnant with a big litter in a hot environment is not going to do well. What type of lighting do you have in the kennel? Is it daylight? Is it daylight fluorescent? And how many hours a day is there lighting? How and when did you confirm pregnancy? That's a critical issue. Whoops. Because many people think that the bitch was pregnant and is not. And if you're using palpation, you actually can't tell on palpation if what you're feeling is a fetus or pus in the uterus. So you need to confirm pregnancy 30 days post-breeding. What ovulation timing is used, and we're going to talk a lot about progesterone. And was ovulation confirmed by using progesterone? And is the progesterone measured again after the last breeding in that cycle? So let's talk about the normal estrus cycle. The typical estrus cycle includes proestrus with a serosanguinous vaginal discharge 9 days. Estrus standing behavior is about 9 days, and diestrus is around 60 to 63 days. And this little chart shows you the hormones that happen when a bitch comes into heat. So as you can see, estrogen, which is the red line, starts to rise before the bitch actually comes into heat. And it rises fairly drastically, comes up to this point, and before it reaches a peak of estrogen, and we don't measure estrogen in breeding dogs, you get a brief but short rise in LH. LH is the hormone that causes ovulation. Theoretically, a bitch will ovulate 2 days after the LH peak. But coincident with that, you can see that progesterone goes up. It's this dark blue line, the yellow line, and will reach its height during the fertile period and stays high. And it stays high to some level up to about day 61. If a female is not pregnant, her progesterone actually stays high or can stay high a little longer. Breeders assume that a bitch should be bred on day 10 and 12. In reality, proestrus can last up to 17 days. A diestrus, I'm sorry, I'm going too quick. Diestrus lasts 59 days after ovulation. Abnormal cycles include, and we're going to talk about all these cycles, anovulatory cycles where a female fails to cycle, slow preovulatory progesterone rises, cycles with an insufficient luteal function, which is what I know there's going to be questions on when and when not to use Regulate. And I think you guys need lots of training on that based on what I've heard so far. Split heats, persistent estrus, and failure to cycle. Timing cycles. In order to manage breedings effectively, you have to have pre-ovulatory serum progesterone measurements. Progesterone values are used to estimate the day of the LH peak, which we call day 0. Both the timing of breeding and the timing of parturition are critical to know when we believe that the bitch did ovulate. Typically, now you have different numbers in Canada than we do here. In the US, we measure progesterone in nanograms per mil. And universally, across laboratories, a progesterone of 2 nanograms per mil is associated with the LH surge. In theory,
I'll jump in there, Dr. Fran. It varies by clinic. Some use nanograms, some use nanomoles.
Okay.
Just so you
All
know.
right. Okay. So 2, and there is a conversion for nanomoles, so your clinic will certainly be able to tell you that. In theory, the typical bitch ovulates 2 days after the LH surge. Now let's talk just briefly about the LH surge. In contrast to progesterone, which once it starts, pretty much stays there for a while. LH is a burst of a hormone and then it's gone. So it is difficult to reliably measure an LH peak unless you're doing multiple LH. So theoretically, the bitch ovulates 2 days after the LH peak, and theoretically, 2 days after that, she has eggs that are ready to fertilize. The reason for that is the bitch ovulates a primary oocyte, and it takes about 48 to 72 hours for that egg to mature before the sperm cell can fertilize it. Progesterone values at ovulation vary by laboratory, but are generally in the 4 to 10 nanogram per mil range. Again, I get lots of calls from people who say, my bitch's progesterone is 12 today. Should I breed her or not? I have no idea. It depends on what kind of technology, the lab that it was run at, or if you run your own progesterones, and what the ovulatory range is for that machine. 12 on my machine is not the 12 on somebody else's machines. So the methodology of progesterone testing influences those numbers and makes interpretation of progesterones obtained by different techniques a challenge. So I can't tell you if 12 is good or not. And I can't tell you, is 25 too late? I can tell you that doing frozen semen breedings in my clinic in Minnesota, we had the best luck with frozen semens using the machine that we use if they were bred between 19 and 25. Now that could be totally different with different technology. So let's talk about split heats. In a split heat, the female starts to get vaginal swelling and bloody discharge, and it occurs without progression to ovulation. followed by a brief period of anestrus. Most of the time, they go out of heat for about a month and come back in, and it's a completely normal heat. Very common with a first heat in many, many breeds. And it'll be, you have the client will call and say, well, I thought my bitch was coming in heat. She bled for about 5 days and then it stopped. These bitches with a split heat are fertile during the normal portion of the cycle. Here's where you'll get into trouble. If you have a bitch that has a bloody vaginal discharge and she'll stand for a male and she is bred on what is actually day 4 and 6, because that's when the stud wants to breed her and she stands, and it's prior to ovulation, she is not going to be pregnant on that cycle. Some bitches do show split heats as a manifestation of abnormal interestrus interval. And I don't think, I want to mention just briefly interestrus interval. That is the period when the female is between her cycles. Normal in the bitch is 4.5 or preferably 5 to about 9 months. If a female has a short cycle, meaning if she cycles about every 4 months or less than 4.5 months, while she may ovulate, that does not allow enough time for the uterine lining to repair itself. And even though she may conceive, she will not maintain her pregnancy. So short cycling is a big problem in certain breeds of dogs. The breeds that I see it the most commonly are the Bernese Mountain Dog. They're notorious short cyclers. German Shepherd dogs, and some of the setter breeds. Another big problem, in fact, I had a call about this today, is silent heats. The heat where external signs are not visible. The bitch has
I got a
minimal.
we've got a question. And I just wanted to jump back in for questions. So we're
Sure.
gonna take some questions throughout the presentation. So if you think I'm skipping your question, I'm just trying to look for ones that are pertaining to exactly what we're talking about. But I'm very, very sorry if we can't get to all of them. We will try. But we'll try, but we're only here for so long. But the other thing is, so ask your questions in the Q&A box as we go. I'll be going up and down the questions to try and get Dr. Fran to answer as we're going. But we are going to do a Q&A again after the sponsor message that I have. Okay, so we have one on split heats. If a bitch has a split heat, did get pregnant on the second half, will she most likely have another split heat or a regular cycle on her next?
The answer to that is it's completely variable. If it was her first heat, from then on they may be normal, but there are some bitches that do have repeated split heats. That's not as common as having it once.
Perfect. That was the only one on
So
split
should we go
heats.
on?
Yep.
Okay, all right. So with silent heats, minimal vaginal swelling, vaginal discharge, but normal follicular development and ovulation. The most common cause of silent heats is the owner failure to observe heat. What I recommend, if you're expecting one of your females to come in season, particularly if she's one of these fastidious ones, or if she doesn't sleep on your own white sheets, is that you take a tissue or a paper towel and actually blot her vulva every day to see if there's any kind of discharge with any kind of color or even increased discharge. Silent heats may occur in bitches under heavy physical activity or training stress. You can see it in some field trial Labradors who are training really, really hard and competing all the time, but they are still cycling and are normal. Block the vulva daily for any discharge and start vaginal cytology and progesterone measurements as soon as any discharge is noted. With a couple of these bitches that I have worked with, the first time we do a progesterone, the bitch is actually at a level where I say, you better hope that stud dog is within a couple 100 miles, or we might miss this. If this goes on for months and months, another thing that you can do is run a progesterone on that female monthly, because again, if she ovulates, her progesterone should stay above a baseline level for at least 7 or 8 weeks. So that will tell you if she at least has been in heat and ovulated within the last 6 months, and give you an idea of when she might be back in. An experienced stud dog may detect a silent heat. I hear that all the time. And there are probably some stud dogs who are right. There are also a lot of stud dogs who will breed any bitch that you will hold, whether they're in heat or not. And some stud dogs only breed bitches when their progesterone is really high. So it's a help, but it's not the be-all, end-all. Slow preovulatory progesterone rises. This is the most common, unusual cycle I see in reproductive practice. So the bitch comes into heat, everything looks great. She gets to a plateau at about 2, which persists for a number of days. Meaning, we talked about the fact that usually when they get to 2, you get an LH peak, which causes ovulation, and then the progesterone will go up. I have seen this last as long as 18 or 19 days. And then once they start to go, they rise very, very rapidly. Very frustrating for both the client and for the veterinarian. And I would commonly have breeders say to me, just how many of these progesterones am I going to have to pay for? And I would say, only God and your bitch knows. So we can quit anytime, but we're not there yet. So
We also have a
slow
question
rise,
kind of on
okay.
that. Somebody says, my bitch will not go into ovulation. She is inconsistent in her heat, normally short. Would that suggest cysts on her ovaries?
What I don't know what they mean by short.
I'm guessing the length of the cycle is short, but it's also
My
inconsistent.
suspicion is if it's short, they're missing the whole first part of the cycle. That's the most common. And some are not really obvious then, but if she goes on and ovulates, her cycle is normal.
Okay. And
So
then,
this slow rise indicates the cycle is unusual, but not necessarily infertile. Cycles like this often require multiple inseminations. And it's also more difficult to tell when the puppies are due with these cycles because the LH peak is not distinct. So that in that case, was her LH peak really at 2, or was it later than that? So it makes things much more complicated. I've had normal litter sizes with that. I have noticed anecdotally, this is not scientific, that if a female goes normally along and she's day 6, and then the next day she's day 11 or 12, those bitches typically tend to have bigger litters. So this is an example of a Labrador bitch of ours and her progesterone curves. She was not bred on this particular cycle. So as you can see, and she was a field trial bitch who was very hard to catch in heat. So I wanted to see if she actually had a normal cycle. So you can see when we first did the progesterone on April 25th, it was 0.467, very low, below baseline. But she rapidly went to 5.62, and then the next day was at 9.4, which I would call ovulation. So that's only, quote, a 5-day cycle. But remember, we talked about the fact she's hard to catch in heat. She has maybe a semi-silent heat. And so ovulation probably for my particular machine is right at around 10. If she were to have been bred, I would have bred her 2 days later. which was May 2nd. And then 6 weeks after that, we measured her progesterone, which was 8.74. Had she been bred, that's a high enough progesterone to maintain a pregnancy. That's not abnormal at all. Her second heat, again, I want to show you pretty much what she did. And it's a similar pattern, but not nearly as rapid. So here we had baseline. 4 days later, there's no real difference between these two values. 3 days later than that, still 0.308. We're now 7 days into her cycle, and she's doing nothing. 4 more days, she's finally at 2, and then whammo, up we go to 11.5, up to 28.1, 13.7, again, a completely normal cycle. So it's very helpful to do these patterns. I admit they're expensive, but if you have a bitch that is really important to you and you really want ones from that, that'll give you some ideas of what they are going to do. Now this is her third heat. Okay. And let me see if I can move this down. Okay. You can't read the bottom number, but it's 17.4 on the 20th in the afternoon. So she went from 11.6, which is an ideal breeding time, to 17.4. She was bred once that day, and she had 13 puppies. So with timing, you can overcome that. Anovulation. These are cycles where the bitch actually does fail to ovulate. And it's failure of the serum progesterone to get above 2. The vaginal smear, if you do it every day, they go from non-cornified to cornified and back to non-cornified. Progesterone concentrations characteristic of diestrus fail to occur. So her progesterone doesn't go up, nothing happens, she goes into anestrus. So anovulation requires a combination of vaginal smears and quantitative progesterone beginning with the first 5 days of the cycle. Causes of anovulation are not great things. It's failure of the ovary to deliver enough estrogen to elicit an LH surge. So really basic, way at the beginning of all of the reproduction. Insufficient gonadotropin releasing hormone from the hypothalamus, or failure of the pituitary to secrete sufficient LH. Failure of the ovary to respond to the LH surge. Treatment is not recommended because most females cycle normally at the next cycle. Some authors give HCG, that's human chorionic gonadotropin. However, that can result in the female staying in heat forever or a pyometra. So this is where I talked a little bit to Sarah about this insufficient luteal phase. There's a real trend now, and in a way it's really good, in a way it's not so good, to, I'm going to say, over-monitor pregnant bitches. So let's talk about what I recommend for pregnancy monitoring. First of all, I would say, breed your bitches. The day that you do the last breeding, run a progesterone. On day 25 to 35, depending upon your veterinary hospital, do a ultrasound. If she's pregnant, you're good to go. If she's not pregnant, you definitely want to do another progesterone to see if she, in fact, did have a sudden drop off in progesterone for some reason, okay? And because you need to know whether she failed, if she failed to conceive, or later on, if she actually resorbed her puppies. If there are puppies there on that 30-day ultrasound, and now all of the fetal vesicles look about the same size, you probably don't need to do anything. Monitor, well, feed her well, take good care of her, but monitor her for any changes in behavior, change in water consumption, any vaginal discharge. And if you see anything, see your vet. If you see any of those things, run a progesterone a couple of weeks later. Or if this bitch has a history of delivering her puppies early, then run another progesterone at about the 6-week stage. And then we're going to talk about at what numbers, if you're going to supplement, you do, and what the risks are. So luteal insufficiency is a decrease in serum progesterone to less than 2 nanograms per mil prior to diestrus. It can occur shortly after ovulation. They can ovulate to latent diestrus. Can occur whether the bitch is pregnant or non-pregnant. Luteal insufficiency cannot be identified without measuring serum progesterone on a routine basis. Again, I recommend measuring progesterone at the time of ultrasound for pregnancy if the bitch is not pregnant or has a previous history of pregnancy loss. Luteal insufficiency is poorly documented as the cause of canine embryonic resorption or abortion. If you have a progesterone of less than 2 for greater than 24 hours, typically you will lose the pregnancy. Many bitches late in pregnancy have their progesterone drop even below 5 and still carry their litters full to term. You need to do other stuff to see if you're at risk for pregnancy loss at that point. Progesterone replacement therapy can be given. All products used involve extra label usage, meaning there is no progesterone formulation that is labeled for dogs. Most practitioners use Regulate, which is for horses. Some practitioners use progesterone in oil, all different types of progesterones, but none of them are labeled for dogs. When I used it, I made the client sign a consent form acknowledging that given exogenous progesterone, meaning progesterone we give to the dog rather than the progesterone that she produces herself, can masculinize female puppies, and inform the client that this is extra label use and that's the risk. Now, the bad thing with that is the puppies may look like females and you may not know that there is some impact on their reproduction until later in life. And I have seen in some of the cases we'll talk about soon, in some miniature bulldogs, where the progesterone, I believe, contributed to abnormal development of the prepuce and penis in male puppies. So if you start giving Regulate or anything after day 50, it has less impact on the fetus. Progesterone measurement using chemiluminescence or radioimmunoassay does not measure allitrenbolone. And what that means, the drug that you use, Regulate, is allitrenbolone. It actually isn't progesterone per se. So the way I measure progesterone and the way many labs do, it will give you what the progesterone actually still is. So if I measure progesterone on a dog who's on Regulate, the number that I get is actually the number that she herself is producing, but the allitrenbolone prevents her from having early pregnancy loss. So again, the measurement that I measure reflects the progesterone the dog produces. You have to stop allitrenbolone by day 60 to 61 post-breeding. Oftentimes, if you use Regulate, they frequently do not have normal milk production. That can be supplemented, but it's difficult. So this is an example of this miniature bulldog that we'll talk about. So if you look here, her progesterone went way up like it should, and she was down to under 5 on, let me see, 428, about 7 days before whelping. And she did whelp the next day from this, and her puppies were tiny, but did survive, and just barely. So because of that, her owner was concerned and didn't want that to happen again. So here's an example of another one. This is Cricket, who actually is the daughter of the one that you saw before, and her daughter has even a more dramatic drop. So look at these numbers that we have been talking about. Heat started, she'd been in heat about 4 days here at 1.4, had a nice normal cycle, was bred on December 25th, about 6 weeks in, 23.7. 7 days later, she dropped to 7.7, and we started a Regulate on the 5th at 4.7 because of her rapid rise. We actually did one more. And then we did do her C-section on January 15th. Based on when she was bred, we knew she would not be ready to have puppies before the 15th, and probably not until the 16th or 17th. And had we not started that at 4 at the rate that she was going, we did run another one that day, and she was already down to here. We still had 10 days to go. None of those puppies would have survived.
We've got a question in here for
Sure.
Reggie. When do you recommend discontinuing it if they're doing an elective C-section?
You still have to just do it definitely by day 60, and ideally by like day 58.
For a C-section too?
Uh-huh.
Okay. And then we have an update to our first question. So the female that doesn't go above 2,
Uh-huh.
she was saying that her intact male is always interested, and that the cycle is actually long. She just never rises above 2, so she never actually ovulates.
And has that client actually continued to run progesterone?
That's a good question. How long have you been running progesterone?
Right, because oftentimes you might have to run 10.
We just did that on a female. She was baseline for almost 2.5 weeks. I was pulling
Right.
my hair out.
Yeah.
Yeah, she says she tests progesterone every week.
Every week for
Every week for how long? Hopefully we're gonna answer quickly. She's in week 5.
and she never ovulated. Correct?
Correct.
What's the highest she got?
1.5.
1.5. So I would say if she's really interested in breeding her, she needs certainly to have a good abdominal ultrasound and consider either heat induction, or if she's really important, to consider administering a hormone to cause ovulation. I will tell you that one of my personal important viewpoints is just because we can, should we? And my comment about that would be, if you have to go to that much work to have this bitch cycle, you certainly are not going to want to keep any of her offspring. And if that is the case, why bother? Now, from a financial standpoint, as a veterinarian, that's not a good attitude to have, but that's really the truth. What are you trying to prove here? So, yeah.
All right,
My
let's
job is
jump back
to
in.
educate, not to judge. So whatever
Yep.
people want to do is up to them. Okay,
Yeah.
this happens to be an Irish water spaniel. She was bred on October 29th, and her progesterone was 17. Okay. Uh, and then we ultrasound her, and she was not pregnant on December 12th. So her progesterone was way below baseline. And either that meant she never conceived, or she did, in fact, have a loss of progesterone from her ovary. And that was the reason for her not to maintain a pregnancy. Unfortunately, it would have been really good had her owner brought her back 30 days after she was bred to know whether she had conceived or not. And if she had, we probably could have interceded. So her next heat, you can see, well, it was, I think, another year. You can see that she was bred on November 2nd, and her progesterone was bred one time. Pregnancy ultrasound on, let's see if I can move this. And we saw 3 fetuses. We started Regumate on 1-2 because she was down to 488, and realized she was bred she should have whelped. This doesn't make quite sense. She was not due to whelp until let me look at this a minute. 12. We started the progesterone down here when she was below 5, 4.88. And we kept her on it until the 26th. I'm sorry, yes. We withdrew the Regumate on the 21st, and she whelped on the 26th. And we would have thought that she would have, excuse me, would have whelped by the 26th. So she was right on time. And by doing that, we prevented her pregnancy loss. But even so, she ended up with only 1 puppy. Failure to cycle. Tubral estrus occurs at various ages. We don't consider a bitch abnormal until if they haven't had a heat up until 24 months of age. If the female has not cycled by 24 months, we should be checked for previous spay. And and then also abnormalities of sexual development, including Turner's syndrome and trisomy X. Now, if you are, that's what it's called an intersex. And so those dogs genetically are not genetically normal females. A normal female has a chromosome component of XX. They'll look like females, but they really aren't females, and you cannot fix that. That's an interesting thing to know, but realize there is nothing that we cannot do about it. As far as induction of estrus, there are a number of compounds. Aha, I know what that is. There are a number of drugs that can be used to induce estrus. They have variable efficacy. They are all expensive, and they are all not without risk. I will tell you that I have used a drug called, oh, it's gonna pop out of my brain. I'll quit thinking about it for a minute. And it works very, very well. It's an oral cabergoline, a drug called cabergoline that is given for a variable period of time. The bitches do come in heat. Their cycle is very, very rapid, and most of them do get pregnant. But it is an expensive drug, and it is difficult to use. And I would only do that again if I really, really wanted a litter out of a particular bitch. I would not do it as a regular process, and most cycling abnormalities tend to have some tendency to be heritable in the upcoming offspring. So I think this is where you're going to talk about some foods for us, aren't you, Sarah?
Yeah, absolutely. All right. So,
So
as
let me
this,
just comment on that. This is my food of, well, that was salmon and rice. My dogs love that, but I feed chicken and rice, and I don't have any great reason for chicken versus salmon, but 30-20, all life stages is what I like the very most for all of them. And I will say, I do not recommend, and Sarah can choke me if she wants to, the sensitive skin and stomach, this one for pregnant bitches. It is not really intended for that. And notice it is not labeled as an all life stages food. All right, Sarah, you can talk about this and then we'll do a lot more questions.
all right, sounds good. Okay, so as the sponsor of today's panel, I wanted to take a moment to tell you a bit more about ProPlan and what we offer breeders. We have over 40 research backed formulas to meet health, breed size, and life stage need. Every single dry formula has been fed in a feeding trial test, meeting our high standards for digestibility and palatability. We have formulas that feature lamb, salmon, turkey, beef, or chicken proteins, with real meat being the first ingredient. The performance all life stages with doctors, which one Dr. Smith mentioned, and puppy formulas meet the needs during pregnancy and nursing. One of the nice things about this nutrition is you can keep them on it pre-pregnancy, during, for some time after, and not have to worry about switching diets. The sensitive skin and stomach lineup has no corn, wheat, soy, or chicken, and all this with a great taste dogs love. I know my dogs certainly do. They have a motto, no kibble left behind. Next slide, please. Purposeful ingredients, responsibly sourced. Every single ingredient we use is purposefully selected. Whether it's because it provides just the right nutrients or it's full of the flavor your pets love, we source every ingredient from trusted partners to ensure they're not only high quality, but produced in a way that meets our responsibly sourced standards. Expertly crafted and vet approved, we work closely with a robust team of pet experts, including veterinarians, nutritionists, and behaviorists, to craft our recipes and develop our products, from selecting purposeful, high quality ingredients to developing complete and balanced recipes. Nothing ends up in your pet's food bowl without their stamp of approval. Next slide, please. All right. As many of you know, we have a Pro Plan breeder program with amazing benefits. New this year, we launched a Pro Club Platinum tier where breeders get rewarded for their Pro Plan recommendations to new pet owners. To upgrade to Platinum, log into your Pro Club account, upload your breed specific related health testing for a sampling of your breeding age dogs. If you're interested in trying Pro Plan, the Pro Club loyalty program for breeders offers great benefits and is the #1 choice of Canadian dog breeders. We offer 3 easy ways to save on Pro Plan. You can get bulk delivery for most regions in Canada on volume orders. You can earn a $20 credit on every large bag of Pro Plan or $10 on every box of Fortiflora with our new easy online rebates. You just snap a picture of your receipt and upload it in your account. We have a 20% in-store discount with PetSmart where you can save instantly at the checkout. And members, stay tuned. We're launching an early Black Friday Pro Club promotion in the next few weeks. And next slide, please. And then our fabulous puppy kits are shown here, and they include a free box of Fortiflora probiotic for each new puppy owner, a coupon for a free small bag of puppy or all ages, not a full bag, not a sample size, a full bag, coupons for 3 free cans of Pro Plan puppy wet food, and $10 off their next bag, plus 1 free box of Fortiflora veterinary supplement for the breeder when you order your kits. All of your pet owners can get a kit as long as your account is in good standing for eligibility. If you're interested in signing up or learning more about our breeder program, you can visit purina.ca/proclubdog. And that's all for me. So we're going to go back over
I
to
have
Dr.
one other
Fran.
comment. I have one
Yeah.
other comment about food. In the US, and I'm sure in Canada too, we have many veterinary specialties, including veterinary nutrition, which is certainly they didn't have that when I was in vet school. But I will tell you, a fabulous board certified veterinary nutritionist at the University of Minnesota named Dr. Julie Churchill was asked to do a big expose on dog food in the Minneapolis-St. Paul area, and they sent her out to buy foods or people out to buy foods, and she picked the best. And she said the gold standard in dog food nutrition is that the food was tested using a feeding trial. And Purina is almost the only company that ever actually feeds their food to dogs. Most dog food is only tested in a chemistry lab. So yay, yay Purina.
Yes, every single one of the dry formulas is feed trial tested. Absolutely.
Yep.
We have so many questions. So I'm gonna say this again. We will try to get all of your questions. Um, as Dr. Smith said, she can't give you very specifics as to diagnose your dog, and some of these questions are very narrow into the topic. So we're gonna do our best. I'm very sorry if I skip your question, but we are not going to be able to answer all of them because I see them piling in.
Okay.
But we've got quite a bit about food while we're on the topic. So do you believe there's a link between pulse, pea protein based food, and infertility?
Say that one more time, Sarah. I'm sorry.
Do you believe there's a link behind pulse, like the pea protein based foods, and infertility?
No, I do not.
Okay. And then, do you add any supplements or feed more when they're in heat to accommodate for blood loss?
The amount of blood lost in a normal heat in a normal bitch is insignificant. So there's no reason to change that at all.
Okay. And then we've got a question here that says, I feed Purina chicken shredded and then switch the moms to puppy once pregnancy is confirmed. 30-20 seems to be what all are doing now. Is it okay to stay old school if that's what's working for them?
The last part of the question is it okay to do what?
What's working for them? Like stick with what they know?
Um, the shredded formulas typically are not all life stages to the best of my knowledge. So I would do in all life stages from the day she comes in heat all the way. And I don't see any reason to stop after their puppies are weaned. If they tend to get too heavy because it's a very digestible food, the easy answer is give them a little bit less food. It'll also save you money and they stay in much better metabolic and nutritional condition.
Okay. We had another food question. Small puppies, you say nutrition has to do with how large the puppies are. Her last litter, she had 4 to 6, and 4 were very small. She was able to save 2 of the 4, and she's using shredded salmon, and she has um, Picards and Irish setters. How big of a role does the food play?
So as far as small puppies within a litter, there's a number of different possibilities. Many times puppies are small. If it's in a great big litter, it's because of the type of placentation that the dog has, and there's competition for where those placentas can attach. So if there's 13 puppies, that's a lot of room taken up. So if a puppy has a small placenta, it's going to be a small puppy. So since this was a relatively average Irish setter litter, I would be concerned that maybe there is some pathology going on in that bitch's uterus itself. Females, as they age, tend to develop a degree of what we call CEH, cystic endometrial hyperplasia, and their uterus is not as healthy. So if it's a bitch of that age and there's some of that pathology, the placentas are not going to be as strong and the puppies will be smaller. But again, I would feed an all life stage food all through pregnancy. Shredded, I don't believe is all life stages. Is it, Sarah?
The shreddeds are not. No, there is a
No, I
puppy
didn't think
formula.
so. No, yeah. Okay.
Okay, we've got another interesting one in here. Okay, so this person is feeding one of the Pro Plan All Life Stage lamb and rice. When you were talking about nitrates in the water causing issues, if I do
Yeah.
have nitrates, Will the progesterone drop if the bitch isn't pregnant? I'm asking because I have 3 bitches that seem to have normal cycles. I progesterone test, but when it comes to ultrasounding between day 28 and 32, the result is negative. The stud was frozen in the spring and again recently, and the results of the evaluations were almost identical. So,
So these were frozen semen breedings?
yes.
That's a whole different ball of wax, frozen semen breedings. I don't think the nitrates have anything to do with that. Excessive nitrates in the water can be toxic to fetuses, but also can cause cleft palates. But my suspicion is timing with frozen semen is critical. And thawed frozen sperm really can only fertilize for about 12 hours. So if
Oh,
you're
my
not,
my apologies on this one. She was just saying that the male was frozen earlier this year, but it was a live breeding.
oh, it was a live breeding. Okay.
Yeah,
And has he sired puppies though? We don't have any information on that.
we will have to wait on that one.
Yeah, right, absolutely. Because the fact that the semen froze or that it was a live breeding doesn't really tell us anything about the male semen quality. But I don't think the nitrates in this case had anything to do with the issue.
He had 3 live puppies, but it was 2 years ago.
Okay. So he might have all abnormal sperm. So
Okay.
probably the stud dog.
Okay, okay, so we've got some questions on your comment about the sensitive skin and stomach and why
Yeah,
that's not recommended. I think sh I think what she's saying is she doesn't recommend it during pregnancy because it's not all life stages.
that's
But
correct. That is
okay.
absolutely correct. Yes.
Yeah.
It's a great food, but not during pregnancy.
All right. I trying to flip through these. They're coming in quickly, but I'm trying to find the food ones before we go on to the next topic. But that might be it. Okay, let's try and go back up. Okay. Okay, let's go back up. Okay, got that one. Okay, brucellosis question. What are
Yeah.
your recommendations when using old frozen semen where the stud dog is no longer alive? Can brucellosis survive the freezing process? Are you looking for a brucellosis test report at the time of collection? Say the dog was collected 15 years ago.
Okay, that's a great question. Brucellosis can survive in frozen semen. So at my clinic, when we froze semen, we did a brucellosis test the day we froze. So you knew that the dog was negative on the day of collection. If the semen that may or may not have been done. Currently, I don't believe that there is any brucellosis test that you can do on thawed sperm. You can do a lot of DNA tests, but the technology for brucellosis testing is differently. You probably would have to decide if it's worth the gamble. What you might be able to do is, if it was 15 years ago, the dog is unlikely to be alive, but check with anybody who bred to him around the time the semen was collected and see if there were any issues. That's probably the best you can do.
Okay. The next one I've got is in 25 years of breeding, I've only had 2 reabsorptions. A 2-year-old maiden bitch, progesterone protocol followed for frozen semen, confirmed pregnancy at 25 days, loss 10 to 15 days after confirmation of fetuses. 3. There was 3, and then they lost the litter.
Okay.
The
Did they
second,
do did they do another progesterone at the time that the loss of the litter occurred?
I will see if they are still on and we'll answer that. Um, but the second one is second bitch was 3 years old, 4.9 nanograms, had 2 natural litters prior to breeding. Male semen tested at 90%, and the pregnancy reabsorbed. Sounds like the same thing, 50 to 55 days. So, Toby, if you can answer if yes, progesterone dropped to 2.1.
Okay, so one of the issues, and we're both of them were confirmed pregnant with ultrasound. Yes?
That's what it said, yeah.
Okay. One of the issues in what we call premature luteolysis or an abnormal drop in progesterone is we don't have the cause and effect. We don't know, and there is no research pending that tells us if the progesterone drops because the puppies die or the puppies die because the progesterone drops. But my suspicion is something else was going on that caused her to lose those puppies. Now, in retrospect, and it's always genius, if in fact they had done the ultrasound and a progesterone at that time and repeated it a week later, if it was a progesterone issue, there would have still been enough time that you could have done something about it if it was progesterone only. But we're always geniuses in retrospect.
Okay, so with that, one of the write-in questions for somebody that had emailed us prior was with this progesterone drop, kind of like the one that I had emailed you about, the 10.97 to 9.5.
Uh-huh.
At what point do you start Regimate?
Okay. I would tell you, I never start Regimate before 5. Never. And I'm reluctant to do it if it's 5, and let's just say the bitch is 55 days. I would, rather than start Regimate, I would have her back in 2 days, run another progesterone and see what it's doing, because you need to stop by day 60 to even have a normal delivery.
Okay.
But never below 5. I mean, above 5, ever.
Okay.
So if they're at 5 and we're worried, I might run a progesterone every day. And I know that's expensive, but it's better than losing
Yeah.
a liver.
Yeah. Okay. And then do you recommend ultrasound rechecks throughout the pregnancy when Regimate supplementation? And if so, how often?
Weekly. I recommend weekly
Weekly
ultrasound.
ultrasounds?
Yeah.
Okay.
Yeah. And
And
what I'm looking for there is if we still have the same number of puppies and if the puppies have normal heart rates or not.
okay. And if they're started on Regimate, it's not something you can stop.
You can, yes, because you're not interfering with the progesterone that the bitch produces herself.
So it won't cause her to go into like early labor or anything.
No, no.
Okay. Okay. All right. Let's get back to some more questions. Um, okay. If a bitch has bled normally in the past, presents with swelling, progesterone rise, but is barely bleeding very pink, is that a fertility concern? This is a young
Not,
bitch.
not at all. Absolutely. Bitches vary tremendously in how much they bleed and for how long. About 20% of normal bitches bleed throughout their entire cycle. And it's okay. It's just really annoying.
All right. Okay. What do you think of a bitch having her first season at 30 plus months? Her ovulation was confirmed by progesterone. Her vulva was not swelling at all, which was quite unusual, but her male was interested and she was bred. No pregnancy. So there was
Okay.
she did not get pregnant.
What breed?
Lise, can you let us know what breed? We'll see if she's a Lagotto Romagnolo.
I have minimal experience with reproduction in that breed. Many of the sight hounds will have that exact presentation, and it doesn't concern me. So I suspect that this is normal, and she's okay.
Okay. The next one is thoughts on giving Medicam orally for 3 days post ovulation.
That recently has just come up. on the ACT listserv, which is our kind of chat box sharing information. I have only seen it suggested, particularly with transcervical inseminations. And what I suspect is TCIs always cause some trauma to the cervix. And so using an anti-inflammatory post-TCI may be reasonable. But I have not done so, and I don't know that I recommend it. I feel that it would be likely harmless.
Okay. And then follow up from a different person. Thoughts on giving Medicam post-surgical artificial insemination?
Always.
Okay. There we
Always.
go.
I mean, if you had an incision, would you want your doctor to send you home and say you can't take Tylenol? No. I mean,
No.
no, 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 yeah.
Right. Okay. Does hypothyroidism cause an anovulatory heat cycle, or do they normally cycle ovulate normal but fail to stick in the uterus?
Um, Hypothyroidism really has pretty minimal, unfortunately, well, fortunately and unfortunately, effect on reproduction. When they have done really, really, in the olden days, when you could have breeding colonies of dogs, the dogs where we knew that they did not have a thyroid because they were surgically removed,
Mhm.
still cycled and were able to reproduce just fine.
Okay. Okay. Okay, we have one with progesterone numbers here.
Okay.
Did progesterone starting at point 0.4.
Yeah.
5 days later, it was 1.1.
Okay.
3 days later, it was 6.6. One
Okay.
day after that, it was 10.5.
Yep.
Our vet did not run another progesterone, but bred the bitch 3 days later in an early morning surgical AI with frozen. The bitch did not conceive. Was she bred too early?
Well, that really puts me under the microscope, perhaps, but we don't know because I've said throughout this entire lecture, the day you do your last breeding, you should always do another progesterone because we assumed at 10 that 3 days later she would be right. But bitches neither can count nor read. So maybe.
Yes. All right. So, recommendation is to continue progesterone. Okay.
Right. And certainly the day of a surgical AI, always do a progesterone.
Yeah.
Now, I say that everybody doesn't have progesterone technology in their office. But if nothing else, at least draw it so you have it, so you have know what might have happened or not.
You never want to think back and go, what if? What if we did one more?
Right, absolutely.
What if we had the answer of the blood in the freezer?
Right, right.
If a dog in a litter is intersex, is that just something that happens, or is there a possibility that others in the litter may be affected? The intersex was discovered accidentally. The dog presented as normal female until about 7 months of age.
What breed?
What breed of dog? Okay, we might have to wait a second for this one.
That's fine. The reason
Mm,
I ask that, there are breeds of dogs that have
Weimaraner.
a Weimaraner.
Yeah.
They are known to have intersex. Odds are if the other puppies look normal, they're normal. But Weimars are a breed with increased risk of intersex. Miniature schnauzers are huge. Actually, pugs have a fair amount of it. English Cocker Spaniels have a lot of intersex. And a lot is a relative term, but that's relative to other breeds that don't have it.
Okay, we've gotten a couple of questions about the Cabergoline protocol. Can you talk further into that?
Cabergoline is an oral medication given to induce heat. The bitch has to have not been in heat at least within the last 60 days. It is given daily until there is vaginal swelling. You have to watch them very, very carefully, run lots of progesterones. Typically, they have a normal cycle, but you have to confirm that they do ovulate. The duration of treatment can be anywhere from a couple of days to 6 or 7 weeks. The drug is expensive.
Okay. Excellent. We've got another food one. Should a bitch be supplemented with folic acid during heat and pregnancy if they're eating 30-20?
They don't need any. There is anecdotal information that 5 milligrams of folic acid given to brachycephalic breeds may be beneficial. It is not a controlled study or a scientific work, but folic acid is a B vitamin. You can't hurt a dog with folic acid. So if it makes you feel good to give the dog folic acid, go ahead.
Okay. Do you recommend avoiding fish-based formulas during pregnancy, or are fish-based formulas tested for mercury contamination?
I would tell you that if you're feeding a Purina product, you don't have to worry about it.
Okay. Um, we've got a couple repeats. How Okay. How many failure to conceives would you take before investigating the female's fertility?
I don't want to be too facetious with this, but my instinct would say is it depends upon how much money you want to throw away. But if it were me, by the second failure to conceive, I would be willing to put a lot of investigation into it.
Okay. The next one is field trial pointing breed stud dog. What are considerations for timing? I've heard they need to be retested from field trial for 2 months before being used for breeding. Oh, I'm guessing this is a brucellosis question. Correct me if I'm wrong, Shauna.
Okay.
But we do have more brucellosis questions.
So realize from the time a dog is infected with brucellosis until it tests positive is going to take a minimum of 30 days. So my recommendation that a bitch be brucellosis tested before every breeding, and that a stud dog be, if he's being commonly used, every 3 months. If he's rarely used, certainly before he's going to breed a bitch. I mean, I assume the bitch owner will contact them.
Okay, I just got an update. Not brucellosis. She meant sperm quality based on body condition.
Well, it's not even body condition as much as work, and particularly dogs that work in heat. I now live in Mississippi, and I can tell you the dogs that work and train down here in the summer reliably have decreases, sometimes huge, in their sperm counts. Not in the summer. Remember, we talked about 70 days later. We had a brutal summer here, and it's now October and cooling off. But I would expect if I were seeing dogs in a clinic every day now, that a high percentage of them would have low sperm counts and that they will likely recover by December or January.
Okay.
Heat is terrible for sperm cells.
Okay. Okay, before we jump to the next question, how much more time do you think we have for questions? I just want to ask you that before we get to too many of these, because there's a load of questions in here and they just keep coming in.
How about 10 more minutes?
Okay, perfect. All right, well, so we'll cut it off at 9:30. Let me just go back to these questions. If you run a progesterone after an ultrasound showing a bitch is not pregnant, the level will let us know she did absorb. So if it's over 2.
No. If she's not pregnant, you want to make sure, you want to know the number that her progesterone is. If she ovulated it should still be high. And I would expect for most females, it'll be 15 or above. So that's what you're looking for.
Okay. We've got a lot of questions about progesterone machines. Is there one that you recommend for breeders? Because there's quite a few questions in here about, is there one you recommend because they don't have access to one freely at the clinic?
Okay, so I am not, I'm not an engineer and I'm not a technologist. In my veterinary practice in Burnsville, we had an Immulite, which is a very sophisticated machine that does progesterones by chemiluminescence. That machine runs around $50,000. So it's unlikely that breeders are going to have those machines themselves, okay? Now that I've retired and I have only my own dogs to breed, I use a machine called a V-Check 200. And I have had very good luck with that machine. Now, what I will tell you with the machines, to the best of my knowledge, they all work. But you really have to spend some time and money to do a correlation curve between the values you get and a reference lab. And as an example, when I got my V-Check, and I got it before I left my practice, so I could use my Immulite as a control. But you can send them to Antec or IDEX. I don't know who your big reference labs are, but maybe the same. I sent a sample that on my machine, my V-Check was 2 to the reference lab to see if my 2 was the same as their 2. Because the numbers you most need to know is 2, which is associated with the LH peak, and then a number that somehow identifies what appears to be ovulation. And for my machine, it was 10. I believe the number at that point for Antec, on my and the my Immulite, my 10 was an Immulite 11. So I knew we were really close. Then it doesn't have to be exact, it has to be a correlation. So if you were doing that yourself and you sent a 2 and you got around a 2, I mean, it could be a 2.1 or a 1.5, you know you're really close on the LH peak. If on the other hand, you got a 2 and the reference lab says it's 0 something, you know that you're not picking up the LH peak. Then you have to go to the ovulation number. And if you think it's 10 for your machine, you send your 10, and your 10 might correlate to 15 at a reference lab. So you need to make that correlation so that you know that the number means really something. The numbers they get are real, but you have to learn how to use them.
Okay. Got another interesting one here on progesterone numbers. I
Okay.
recently had a bitch with a progesterone result of 1.3 nm. I assume that's nanomoles on
Uh-huh.
Wednesday, and on Saturday she was 118 nm. One breeding with fresh semen was done on Sunday, and she missed, which was not a surprise. Is there any reason for such a sharp rise? She's not
Nope.
encountered this in 20 years
And
of breeding.
actually, I like sharp rises. They, to me, usually indicate really good fertility.
Okay. Okay, we have another brucellosis one. How frequently do you recommend testing, particularly for dogs that are being collected for freezing and with repeat freezing, assuming they're not coming into contact with any other breeding dogs?
Well, first of all, there's no dog in the world that might not come into contact with a breeding or a non-breeding dog. If you stop at a rest stop, you go to a doggy daycare, you go to a dog show, your dog has the potential at any X-pen, et cetera, to be exposed. So if it's a commonly used stud dog every 3 months, if it's a dog that is rarely used, within a couple of weeks of when he's going to be used.
How often for when they're being frozen?
If
Should
the freezings are like 3 days in a row or once a week for 3 weeks, one is enough. If they're
okay.
being frozen now and not frozen for 3 months, just like it was going to be natural service.
Okay. And then in regards to vitamin supplements, what is not recommended when planning pregnancy?
No fat soluble vitamins A, D, E, and K.
Okay.
So if you're feeding ProPlan 3020, you don't need any vitamin supplements, and never, never, never supplement calcium.
Okay. Can we talk about absorption and why it happens? Surgically done and absorbed at day 34. Bitch has not been able to get pregnant again since.
So my suspicion, it was probably an older bitch. If they're over 4, every time a bitch cycles and has a cycle, it's estrogen followed by long periods of progesterone. That's normal reproduction in the female. It changes the uterine lining. As they have a more abnormal uterine lining, there's more possibility for resorption or loss of pregnancy. Until we had ultrasound, we didn't even know bitches could resorb. We just thought they weren't pregnant.
Okay. At what stage of pregnancy should you be checking progesterone just as a routine checkup?
For a routine checkup, if they're pregnant at 30 days and nothing is going wrong, I wouldn't check any more progesterone. If there's no history of problems, I mean, you don't
Okay.
need to do blood work just to do blood work.
Okay. Um, okay. Is RTCI risk factor for pyometria?
Um, there is nothing published, I would say on that.
Okay. And then what day of the heat cycle do you recommend starting progesterone to get a baseline for progesterone? So at the beginning of the cycle.
Within the first 5 days. Because so often people miss 3 or 4 days before what is the real first day.
Okay. Sorry,
That's okay.
screen, my screen is going up and
Crazy.
down as questions come in and out. Okay, let's see. Are smaller litters, say one puppy, due to the stud dog, semen, or the bitch? Typically, litter size would be about 4 to 5 in the Dandy Dinmont.
Okay. It could be either. Again, in the olden days, we used to say if the dog had sperm, he had enough sperm to fertilize all the eggs. We now know that is not true. The bitch controls the number of eggs that are ovulated, but if the stud dog doesn't have enough sperm, because it takes way more sperm than one to fertilize, well, the presence of way more than one sperm to fertilize an egg. So it could be either.
Okay. Also, I pre-apologize if I'm not trying to skip over your questions. My my screen is going a little crazy with 50 questions still, but we're probably only going to take one or two more with the 9:30 finish. Um, okay. If you run a progesterone after an ultrasound showing, oh no, we already did that one, sorry. What is what what's your first test when you start investigating a female's fertility after a failure to conceive?
The first test I run would depend upon when I saw her next in her cycle. If in fact she came to me, say a month after she failed to have a litter, at that point, other than to make sure that she is physically otherwise healthy, and I guess we didn't talk about this at all, I do recommend that you do baseline lab work before you breed a bitch, because if they have abnormal liver or kidney function, they are less likely to successfully raise a litter, and it's also not good for them. So just a little mini chemistry, a BUN, a creatinine, a couple liver enzymes, make sure they're not anemic. And it is known that if a bitch has a total protein lower than 5.0, she's unlikely to have a successful pregnancy. So that's mid-cycle. It all really, you can't really do cultures. Many things can't be done during the interestrus time. That's too late to have, you shouldn't have any progesterone really that is measurable at that point. So it depends upon when she's presented after she failed to conceive.
All right. Okay, and then one's this one's kind of be shorter. Can I give Fortiflora to a pregnant bitch?
Absolutely. Fortiflora is a probiotic, has absolutely no negative effects.
All right. Well, thank you, Dr. Fran. It's 9:30 now, so thank you. That was a fascinating webinar. As always, I love listening to you talk.
Oh,
And I
good.
want to thank everybody that attended today.
Right.
It was recorded. Will be posted to our webinar channel. But thanks everyone.
Thank you very much. Happy holidays, everybody.